Hello. Welcome. El Gran Misterio. We bring you very important information. I invite you to stay. Mesothelioma endurance rate at 5 years is around 12% for patients with pleural mesothelioma. Patients with the peritoneal sort have a mesothelioma endurance rate at 5 years of 52%. Mesothelioma endurance rate commonly alludes to the level of individuals who live 1 and 5 years after starting analysis. What are mesothelioma survival rates? While examining mesothelioma endurance rates, you might hear other related terms like future, which is the normal time an individual is relied upon to live dependent on birth year, current age, sex and different elements. Mesothelioma influences future in light of the fact that the disease diminishes the quantity of years a patient is relied upon to live. A 2015 meta-concentrate on distributed in translational oncology examined 20 years of information, gathered from 1992 to 2012. The 5-year endurance rate for peritoneal mesothelioma patients was in excess of multiple times higher than the rate for pleural patients. 5-year relative survival rates for mesothelioma. Relative endurance rates are a method of contrasting the endurance of individuals and a particular sickness throughout some stretch of time to the people who don't have the illness. The time span is ordinarily 5 years after conclusion. The rate is determined by partitioning the level of patients still alive toward the finish of the time span by the level of individuals in everybody who are as yet alive. The subsequent rate uncovers if the sickness abbreviates life length. The National Cancer Institute Surveillance, Epidemiology, and End Results Program, otherwise called SEER, bunches malignant growth endurance rates into restricted, territorial and far-off stages. This basically distills the 4 pleural mesothelioma stages into 3, with confined addressing stage 1, territorial generally addressing stages 2 and 3, and far-off addressing stage 4. Factors affecting mesothelioma survival rates. There are a few things that influence how long an individual will live after a mesothelioma conclusion. By and large, for pleural and peritoneal patients consolidated. The main variables related with better endurance were age, less than 45, female sexual orientation, epithelioid cell type, stage 1 sickness, peritoneal event and therapy joining a medical procedure with chemotherapy. Mesothelioma tumor location. There are 4 kinds of mesothelioma, and the site where the malignant growth begins influences patient results. Endurance is fundamentally better for peritoneal patients. Speedy fact. A big part of peritoneal patients who go through HIPEC live longer than 5 years. A high-level peritoneal mesothelioma treatment called hyperthermic intraperitoneal chemotherapy, HIPEC, has fundamentally further developed endurance rates for this malignant growth. The strategy joins cytoreductive medical procedure and warmed chemotherapy. Not every person fits the bill for this forceful methodology, but rather the greater part who do inhabit at least 5 years. This looks at to a middle endurance of under a year for patients with pleural growths. In select investigations, warmed chemotherapy has supported peritoneal endurance to somewhere in the range of 40 and 92 months. A recent report led at Brigham and Women's Hospital tried the same medical procedure and warmed chemotherapy on pleural mesothelioma patients. It announced intense kidney injury in 48.3% of patients, and none of these patients encountered an endurance advantage from the strategy. What works for one sort of mesothelioma may not work for another kind. The leftover 2 kinds of this asbestos-related disease are pericardial and testicular. Together, these record for under 2% of all cases. Middle endurance for testicular mesothelioma, the most extraordinary sort, is 2 years. Pericardial mesothelioma is exceptionally uncommon, with just 200 archived cases in the clinical writing. It creates on the covering of the heart and has a middle endurance going from 6 weeks to 15 months. Defying expectations, Alyssa Hankus. Alyssa Hankus is one of the most youthful long-haul mesothelioma survivors in the US. She was determined to have progressed peritoneal mesothelioma at age 15. Because of medical procedure and the HIPEC methodology, Hankus has been abating beginning around 2002. She currently experiences each day without limit and anticipates what the following part of her life has available. Phase of disease. The phase of mesothelioma at analysis is a solid indicator of generally endurance. Individuals with stage 1 or stage 2 mesothelioma, before malignant growth has spread, have the best endurance rates. Beginning phase patients who get expeditious treatment experience further developed endurance. They are bound to fit the bill for a medical procedure and other forceful therapies. More forceful treatments are related with better results. Most instances of pleural mesothelioma are not analyzed until stage 3 or stage 4. At these stages, the growth is enormous or has spread past the first disease area. being analyzed at later stages mean the illness is more hard to treat and is related with more unfortunate endurance rates. There is no settled malignant growth arranging framework for peritoneal mesothelioma. A few specialists have fostered their own frameworks dependent on the TNM arranging framework. In TNM, T equals growth size, N equals lymph hub inclusion, and M equals metastasis, disease spread, to depict the degree of malignant growth. One model is the peritoneal malignant growth list, PCI, which puts this growth type into 3 phases rather than the typical 4 for different diseases. A 2011 worldwide review including 294 patients treated with cytoreductive medical procedure in HIPEC, utilized PCI to portray patient endurance. Pleural mesothelioma doesn't have great endurance rates when contrasted and the endurance paces of peritoneal infection. The pleural sickness can be more diligently to treat. Patients frequently are not analyzed early enough to get the most forceful accessible disease treatments, and may not be adequately solid to withstand intrusive medical procedures specifically. Defying expectations, Russell-Lumpkins. Russell-Lumpkins was determined to have stage 3 inoperable pleural mesothelioma in August 2014. Specialists let him know he had a year to live. However, Lumpkins beat his dreary guess because of Moffitt Cancer Center's transarterial chemoperfusion study, driven by thoracic specialist Dr. Jacques Fontaine. The original treatment includes conveying high portions of chemotherapy straightforwardly to explicit veins that feed cancers. Mesothelioma cell type, tumor histology. The mesothelioma cell type, or growth histology, impacts patient endurance. The malignant growth has 3 essential cell types: epithelioid, sarcomatoid and biphasic. The most widely recognized cell type is epithelioid, which is additionally the most unforceful. It reacts best to treatment. Middle endurance for patients with this cell type is 12 to 2 years. Sarcomatoid mesothelioma is the most forceful cell type. Patients with this determination have a middle endurance of 6 to 8 months. Biphasic growths have epithelioid and sarcomatoid highlights. More epithelial cells mean a superior anticipation for mesothelioma patients. If the growth is for the most part sarcomatoid cells, future is diminished. Patients with a biphasic cell conclusion have a middle endurance of around 13 months. Age at diagnosis and overall health. All things considered, contrasted in more youthful patients. Over 55% of patients analyzed before the age of 50 live 1 year. Under 30% of patients 75 or more established experience a similar measure of time. Patients analyzed before age 50 have an expected 25% shot at enduring 10 years. That drops to 5.4% for patients between the ages of 50 and 64. The 5-year endurance rate for mesothelioma patients analyzed between ages 65 to 74 is 6.7%. That rate tumbles to 3.8% for individuals 75 and more seasoned at finding. More youthful patients will quite often be more grounded than more established patients, which implies they are qualified for more forceful and viable treatments. More youthful patients likewise are more averse to experience the ill effects of other constant conditions like pneumonic sickness, diabetes or a background marked by different malignant growths. Better broad well-being considers enlistment and clinical preliminaries, as well. Gender. Most asbestos openings happen in the work environment. Modern positions customarily held by men present the most noteworthy danger. This clarifies why men represent most of all cases. Nonetheless, despite the fact that men make up most instances of the infection, ladies with mesothelioma seem to endure longer than men, paying little heed to age, malignant growth stage, race or sort of treatment. For each age bunch considered in the SEER program, ladies fared essentially better compared to men. There are a few potential justifications for why ladies passage better than men. A few analysts accept the further developed endurance could be clarified by hormonal contrast between genders. Ladies are bound to be determined to have peritoneal mesothelioma, as well. This growth type has better endurance contrasted in pleural cancers, which are more normal among men. By and large. Defying expectations, Sally Morton. Sally Morton was 87 when she accepted her pleural mesothelioma determination in July 2013. She believed she was too old to even think about going through treatment, however that didn't prevent her from living far past her future. Morton is among the 8.3% of ladies in her age range who endure over 4 years after a conclusion. Race/ethnicity. Mesothelioma is practically selective to white people, who make up 95% of patients. A piece of this distinction is on the grounds that dark and Hispanic people are more averse to be determined to have any sort of disease, including mesothelioma. Likewise, non-white people generally may have been more averse to hold modern positions related with substantial asbestos openness. Information from Sears shows blacks and Hispanics represent just 8% of all malignant growth analyses. Defying expectations, Casey Coleman. Peritoneal mesothelioma survivor Casey Coleman was 34 when she accepted her finding. After 2 cytoreductive medical procedures and a couple of hip strategies, Coleman has been abating since June 2012. When she's not maintaining her Sugar Bell bakery business in Baton Rouge, Louisiana, she appreciates going with her significant other and scratching things off her list of must-dos. A 2015 investigation of 13,734 pleural mesothelioma cases in the SEER information base observed dark patients live longer than white patients in spite of being less inclined to go through forceful medical procedure. Regularly, patients who have a medical procedure endure longer than the individuals who don't. How do mesothelioma survival rates apply to me? Because of advances in mesothelioma medicines, numerous patients are defying expectations and living past normal endurance rates. Disease endurance rates likewise don't consider late advances in treatment, for example, immunotherapy and other designated treatments accessible through clinical preliminaries. Endurance rates just considers individuals analyzed previously. Anybody analyzed today might have more accessible treatment choices and a superior visualization going ahead. Defying expectations, Chris Gibney. Chris Gibney credits his clinical group and solid help from his loved ones for his drawn-out endurance. Soon after his pleural mesothelioma analysis in 2005, Gibney went through a forceful pleurectomy and decortication medical procedure. He keeps celebrating over a time of reduction. Ways of further developing mesothelioma survival rates. Some drawn-out mesothelioma survivors quality their prosperity living with the sickness to a multidisciplinary way to deal with therapy. Numerous in this gathering incorporate the accompanying elements as assisting them with doing admirably after finding. Looking for care and treatment from mesothelioma subject matter experts. Attempting clinical preliminaries. Looking for references for exercise and recovery to remake strength. Rolling out wholesome improvements to further develop well-being and prosperity. Attempting correlative and elective treatments related to, however not instead of, regular disease treatment. Normal questions about mesothelioma survival rates. Is mesothelioma consistently lethal?